Hey friends, Dr. Juneau Robbins here with my little buddy Boney here. I thought I'd make a quick video about chiropractic and soft tissue injuries today. Here in our practice in Minneapolis, we see a lot of soft tissue injuries. So when you hear the term soft tissue, you're talking muscles, ligaments, tendons, nerves, all those kind of things are intertwined. Let's take this guy for example. This is a plastic model of a spine. So basic anatomy 101. You have nerves that run from the top of the neck all the way down to the bottom of the low back, and they branch off and go to every other part of the body. That's all the nerves except for 12 in the brain and facial area here called the cranial nerves. Let's say this guy was in a car accident. So he's driving, he's hit from behind. Basically what happens, the neck, back, and body is going to jerk in one direction, then snap back upright really quickly. I'm not sure if this will show on camera, but in between each one of these bones, you have the muscles. As that spine goes forward, what it does, it stretches those joints apart, stretches the joints. As they stretch, it stretches the muscle. It can actually tear the muscle fibers. We call that a sprain strain type injury. So say my hand is a muscle, all of a sudden it gets torn like that. Its first response is spasms up and gets really tight. When it gets tight, again, it irritates the nerves that are coming out of the spine. What it also does is restrict the motion in between the joints of the spine. So picture these two joints. Say the muscle's nice and relaxed, they would move very easily one on top of the other. If that muscle between them is tight and spasmed, what it's going to do is going to cause a restricted motion in those joints where you get two or three segments that all are kind of locked together. That's going to restrict the range of motion. Number one, we call that a subluxation in chiropractic terms. So one of the things we try to do is find areas where the muscle is tight, spasmed, and the joint motion is restricted and correct it. We have several massage therapists on staff do that deep tissue massage work, try to avoid the formation of scar tissue and the chiropractic adjustments. Real simple. A chiropractic adjustment is finding an area that's not moving as good as it should. We call that aberrant motion. Restricted motion, you get in, you move the joint slightly, it stretches the muscle or stretches the joint in between there. The body has what's called a physiological reflex. Once that muscle stretches, it stays a bit more stretched than it was before. If it's more stretched than it was before, the joint motion is restored. If that joint motion is restored, it takes the pressure off the nerve, client feels better. It's a gradual process. It's helping the body along the way is what chiropractic does. That's kind of a musculoskeletal piece. I see a patient getting ready to walk in the clinic now, so I'm going to cut this short. Any questions, please do give me a message or drop me a line. Thank you so much. Talk soon. Bye-bye.